like say you go camping for a week and you do a tick check at the end of every day, then in theory the tick can't ever be on there for more than 24 hours, and so that dramatically reduces your risk of Lyme disease.
You've been out walking in the woods. Have you done a tick check yet? It is that time of year, and Ohioans are at risk for Lyme disease because of the deer ticks in our area.
Okay, another question for you now. Do you know the difference between a deer tick and a dog tick? You should, because one carries Lyme disease.
Senior health correspondent Monica Robbins explains what we all need to know about those pesky parasites.
Can you tell the difference between a deer tick and a dog tick? The deer tick is the one with the black legs and black shield on its back. It's also the one that spreads Lyme disease. Finding it can be difficult. It's about the size of a sesame seed. Only the females spread Lyme, but even in the nymph stage. Remember your ABCs: A for awareness, B for bug spray.
Deet actually keeps these ticks from getting on our skin. They do not like Deet. Deet is safe. They can be applied to our skin and keeps the ticks away.
Ticks can't get through clothing, but if you do find a deer tick on you crawling, it isn't a big deal. If it attached and is feeding on you, how long it's been there matters. More than 36 hours? Call your healthcare provider for treatment.
A single dose of doxycycline, and that can prevent that illness from becoming active.
Another warning sign, the rash.
When they do bite and they transmit illness, they will cause a red rash that has central clearing, so it looks like a bullseye.
But the rash can also appear in different ways. And if you're feeling flu-like symptoms in the summer and you've been outdoors, definitely get medical attention.
Lyme disease early on can have these generalized symptoms that could possibly be flu similar or coronavirus similar.
And those symptoms include fatigue, muscle or joint pain, fever or chills, headache, and a stiff neck. So remove the tick with tweezers, pulling up with steady and even pressure to make sure you keep it all intact. And do not crush it with your fingers. Put it in alcohol, a sealed bag, or flush it down the toilet. And if you need medical attention, you may ask if they want you to bring that tick with you. Laura.
Now, what about those people who've been dealing with the effects of Lyme disease? What kind of treatment is out there for them?
Yeah, well, thanks to long COVID research, they're learning more about treating those with long Lyme disease. They're finding often the immune system turns on itself with both illnesses, which causes those long-term symptoms. So different immunotherapy treatments may be beneficial to Lyme patients, too.
All right, Monica Robbins, live for us in the newsroom. Monica, thanks.